So now let's talk about some of the factors that might be affecting your pain threshold. So there is three things to consider here. One is cognitive, one is sensory, and one is emotional. So we're going to talk through each individual one now, how it might be affecting you, but also what you can do to counteract it. So the first one is cognitive. So this might be where you're anticipating that it's going to hurt. So therefore your brain is thinking of negative thoughts and framing itself around the feeling of waiting for something bad to happen almost. So obviously the way to counteract this is to have positive thoughts and a positive mindset of that, a feeling and a belief that things are going to go your way, that you feel as if you're going to be okay, that the pain will be manageable, and just have those positive thoughts that things are going to work out in your favour can actually help with the management of your pain. So when we say sensory factors, what we're talking about is if you are not immobile a lot, if you're not moving around, if it is that you are someone who is used to maybe sitting at a desk for hours on end, if it is that you are not someone who's sporty or goes to the gym or gets out and goes for nice walks all the time, then it kind of becomes more of a sensory where you're not used to the physicalness that comes with giving birth, which may mean that you will feel more pain in labour purely because you're not used to the physical, the sweating and the muscle contraction and all that sort of sensation might be new to you if you is something that's not your normal common practice to do. So this can often be where you might need some medical pain relief assistance, whether that's short term or for the duration of the labour, or it might be where you can try and use your breath and some meditation more to help relax you. So though it's counteracting the physicalness of labour, it's actually doing the opposite effect, and it's trying to relax you and get you to calm down and use your breath to do so while between contractions. And the last one is emotional factors. So this is where if you are anxious, if you're depressed, if you are stressed, if you're maybe angry about the pain and you're getting yourself in that negative mind frame again, that is not going to help with your emotional stability, that's going to help see you through labour. So this is where, to flip it around, is where you need to be able to focus on, again, the positive side and a feeling of belief that you can do this, but also be able to think of the pain as being, it is not beyond you, because it is you, it is within you, it is your body, so it knows its own ability and pain threshold. So it can't be beyond you because it is you. And try and focus in on positive thoughts. If you've done a lot of research obviously before birth, that you have that positive, you're coming from a place of power and positive mindset that you know you can get through labour. And almost like having a sense of control over your own body is going to help you feel like you're in control of your labour, and it's going to feel like you can manage the pain a lot more. So I hope that helps with explaining about the factors that could be affecting your pain management.